Best treatment for PVCs. I see PVCs or premature ventricular contractions every day. So I created this video so that we can talk a little bit more about the treatment of PVCs. My name is Dr. Stephanie Saucier. I'm a non-invasive cardiologist and I treat heart conditions all of the time. And so today we're going to be talking about the management of PVCs. In this video, we're going to be covering the different options for management of PVCs, tips and tricks about PVCs, and how to choose what the right treatment is for you. Let's start with the advanced treatment of PVCs. Sometimes if PVCs are enough, meaning if they're more than 10 or more than 20% of your normal heartbeats, they can actually cause a PVC-induced cardiomyopathy. And so a lot of times we'll ablate that PVC. What that means is we'll have our electrophysiologists or our electricians of the heart. They'll go into the heart invasively and they'll map to identify exactly where in the heart the PVC is coming from. And then they actually burn that area of the heart to make sure that that PVC isn't created again. This helps reduce the number of PVCs and hopefully one protects you from a PVC-induced cardiomyopathy or helps your heart recover from a PVC-induced cardiomyopathy. We don't always jump into ablations for PVCs. That's the most extreme case. Most of the time, PVCs are very well managed with medications. Medications that we use to help treat PVCs include things such as beta blockers or calcium channel blockers, which slow or minimize the amount of PVCs that someone has. These are medications that are easy to take, they're relatively well controlled, and they typically don't have a ton of side effects, although there are some potential side effects. Even simpler, a lot of times PVCs aren't dangerous to you. We often have them, and if they're infrequent, you can do very conservative treatment to help with your PVC management. Conservative treatment means identifying triggers. What in your lifestyle may worsen your PVCs? Is it caffeine? Is it lack of sleep? Is it stress? Is it alcohol? Managing some of these things can really help reduce your PVC burden. The other thing that is very simple and one of my favorite supplements is magnesium. Magnesium is a medication or a supplement that you can take over the counter that helps with managing or minimizing your PVCs. These are some really simple ways to manage PVCs, and a lot of times this is all you need to make sure that you're living a happy, healthy life with some extra heartbeat. The big question is, how do you figure out which option is best for you? Well, first we want to see how many PVCs you're having. So oftentimes we'll have you wear a cardiac monitor that will count every extra beat you have. That's the first step. If you're having a lot of PVCs, we might recommend that middle ground medications to start. If you're having very infrequent or few PVCs, oftentimes I'll have you start with lifestyle modifications and say, okay, let's start with lifestyle modifications. And if we need to advance to either more strong medications or an ablation, we can do that. In some rare cases, if you have these extra heartbeats that are very significant and prominent and you have decreased function of the heart, which we think is because of them, we're going to do a combination of everything. We're going to combine lifestyle with medications plus or minus an ablation of those PVCs. Most of the time, and the majority of the time, PVCs are pretty benign and very easily managed with lifestyle changes. I've actually created a heart health guide that's free that you can download. So click the link below to download the free heart health guide and like and subscribe for more videos to gain a little bit more insight about heart health.